happy to welcome you all to today's webinar, Elevate Your Dental Path, Experience, Connect, and Succeed, which is hosted by Tehran University of Medical Sciences. And this session has been made possible thanks to the support of Dr. Puyan Amini Shakib and the efforts of Dr. Salar Chaichi. Many thanks to both of their commitments to dental education and to students. Now it's my honor to introduce our distinguished guest speaker, Dr. Cengiz Jamash. Dr. Jamash is not only a dental surgeon with extensive international experience, but also a key opinion leader in the field. He is the founder of Jakan Dental World and Dentica Projects, two forward-thinking initiatives that bring innovation, collaboration, and
Thank you very much. Is the connection is good? Yeah.
impressive.
Yeah. Okay. Great. Okay. Thank you very much. Thank you very much for the introduction, and thank you all for the attention and the invitation. And I would be happy just to share my thoughts and the presentation today with you guys. So can I share the screen? Yeah.
Yeah.
Okay. Okay, great. Thank you very much again, and I have not so many slides in my presentation, and if you want, of course, I will just I will turn on different presentations in terms of the situation, in terms of the questions that we might have during the session. And just the main thing for today's session, the main goal is just to show my path, my way in dentistry, and how I used it effectively during the when I was a student in the university, and how it can be more successful and more effective during these precious years in the university. So that's why we named the webinar like Elevate Your Dental Path. Yeah, and of course you have all the opportunities, all the abilities during the university learning, during the courses from the first until the graduation. You have all the opportunities just to grow your portfolio, to be more successful on the international level of the dentistry. So I will tell a little bit about myself more, and we will talk about the self-improvement and how soft skills and hard skills can help us during the career in dentistry. So I'm a doctor of dental surgery, DDS, here in Kazakhstan. I'm from Kazakhstan, from Almaty. I was born there, and I'm 25 years old. I just finished finally a residency on prosthodontic dentistry in my alma mater. It's Kazakh National Medical University here in Almaty. So I have residency certificate, and also during the way I had started practicing more from the fourth course of the university, and I have approximately 4 years of a practice right now, 4 or 5 years of a practice, and that's why I work with aesthetic rehabilitations, with direct and indirect resin restorations, and ceramic restorations. So I'm a GC opinion leader. GC is the Japanese company, and they produce lots of products like composites, also the ceramic powders, etc. So also on the projects, mentioned about Japan and Dentica. Japan is the company we produce dental typodons, dental models for the courses, and also Dentica is like the educational platform where we can organize commercial and non-commercial courses for the students and for the doctors both. And also, I'm dental associate at the ABC Clinic. It's also international clinic. Like they have branches in Russia and here in Kazakhstan. And I also, before working there, before starting the working there, I had also internship there in the Krasnodar in Russia in the end of 2024. So if you check my LinkedIn profile, you can find this information. It's just the screenshots from my LinkedIn profile. Of course, it's we have lots of levels, yeah, during our work in dentistry, and you can find me from the very start, from the Student Scientific Society. It was in 2018 and until the present time. So I will just show you my path, my work, where I started and where I'm right now. And I would be happy that just to share some tips, some life hacks, how to improve and how to use your precious time in the university. In 2022, in June, when I was finishing the 5 years, it's a bachelor's degree in dentistry. When I was finishing it, before that, I got the invitation from the Ivoclar company, the Victor Dalp. He was his ex professional service manager in Ivoclar. He's not working there right now, but I'm really grateful until now for his invitation to the Ivoclar, for invitation of me to the Ivoclar, because it was a very, very interesting project. This picture made in Liechtenstein. It's a picture in the headquarters of Ivoclar company. Liechtenstein is a small country between the Switzerland and Austria. And it's very, very small. The population of this country is approximately 40,000 people, only 40,000. And most of the Swiss people, they come there just to work just in Liechtenstein. It's maybe 1.5 hour from Zurich. So very interesting thing that I right there, you can find me in the center of this picture with dark glasses. Yeah. um, I was 22 years old at the same time that my colleague there were more than 30 years, more than 30 years old, most of them. And they have approximately, most of them, they have 10 plus years of experience. But it was very interesting. I got new friends. I've talked with amazing professors. For example, this on the right side, Professor Danimir Evremovic from Serbia, and also Anton Lebedenko on next to me. Anton Lebedenko, he's from Russia, but he's living for the last 20 years in Switzerland, and also he's the part of Ivoclar company. And Irena, my colleague, also from Serbia. I will show you in the beginning of the presentation, I will show you just, I have lots of photos, but I just reduced the amount of photos to the maximum amount, and I will show you in the beginning a little bit the photos, and after that we will talk about the skills and what we need to do just to have better results in the future after the university and during the university life. This pictures, it's the education. I was participating on the course by Ivoclar too. It was 2023. I was doing my internship in Kazakhstan. We have 5 years of bachelor's degree and 1 year of internship before getting the license of a DDS, Doctor of Dental Surgery. We need to do internship. And during that period of time, I got also the invitation, the second invitation of Ivo Club by Ivo Club to visit Vienna, Austria. And during these 2 days of the educational course, I've met Marko Jakovac on the left side. Marko Jakovac, he's prosthodontist, and on the right side it's Martin von Sonntag. He's a restorative dentist and also working a lot with the composites. And it was also an amazing meeting, and also you can find me in the center of the picture. It's like it was like the friends, the colleagues, they said that you in this picture you are like a lecturer, not Martin von Sonntag. Martin von Sonntag on the left side, you can find him on the front row. So it was very, very interesting, of course. And after Vienna, after Austria, I didn't visit any more Ivoclac courses abroad, but I also was participating on different courses locally here in Kazakhstan, in on different courses. Also coming, we have lots of collaborations with Russian doctors, with Belarus or Uzbekistan doctors, and they come to us, and also we have lots of courses there in Almaty. And yeah, as I said, I have lots of pictures, and all of the pictures I have uploaded on my Instagram and LinkedIn, but mostly on Instagram. You can find it there. But the main thing that you need just to learn more and more and more. And if you work more in dentistry, more than maybe more than 2 or 3 years in dentistry, you realize that you don't know anything about your specialty. For example, in prosthodontics, I see that I do, for example, chamfer preparation, yeah, of the teeth, and I realize that I don't know anything about the BOPT or vertical preparation of the teeth. So I find the course, I go to the course, I learn from the lecture, and also I, from step by step, I realize what negative things I have. For example, what I don't know in the practice, and I try to participate always on commercial. I pay by myself on the courses, and I participate on the different courses, expensive and not expensive courses, just to know what to do on the patients. And I after that I can be confident in the end, and I will be able to treat patients correctly. And also, uh, Fatima mentioned that I'm a lecturer, opinion leader. Right now, I'm a GC opinion leader. And for the 2024 and 2025, I've taught more than 400 participants on offline courses, not online. It's just the numbers of only offline courses, like when people coming on the dental expos or on our private courses and classroom courses for the dentists and for the students. And of course, they pay, they come, they learn, and it's a pleasure just to have different mm, uh, different participants, older participants, young participants, and of course we have amazing people there in Kazakhstan too, just to teach them. It's a pleasure. I realized that probably in the future I would be happy just to work only in the educational part, not mostly in the clinical. But of course, without our clinical job, we cannot grow our portfolio, and we cannot show our cases to the colleagues. So it's these pictures from the previous years. It's as I'm not mistaken, it's 2023, it's 2024, It's 2024. So as you can see, we have lots of we had lots of participants in last year, in the last year. So I teach in restorative dentistry and prosthodontics, how to prepare teeth, how to restore them with a resin, how to restore them with a ceramic. And of course, we need to buy as a dentist if you want to work with high quality result, and if you want to save your health, your body, your back, just not just for not having in the future the problems, professional problems with your health. Yeah, as you see, something like arthritis or osteosclerosis, etc. So you need to work with ergonomic in the ergonomic way. So that's why we need to use loops or microscope, etc. Um, this is my chair in the clinic. I'm a dental associate, as I said, in the ABC clinic. So I work with microscope and with the loops. So what was the start point? Yeah, I want just to come back in the beginning of my journey in dentistry when I started learning when I was started my educational path in the university. So I would just like to talk about science. And first of all, of course, it's a science. And after that, we will talk about the management, networking, and personal brand. And in the end, I will show a couple of cases, and I will tell more about importance of the clinical practice, because of course in the beginning of our careers you can choose to be a scientist, to be a researcher, and to work to work in the university, for example, and teach students. But as you know, if you want to have good impression, first impression by people, by students, of course, you need to show the quality. You need to show the good clinical job. So, of course, clinical practice is very, very important. So I've written this timeline. So on the first course, it was in 2017. Yeah, it was in 2017. I joined Student Scientific Society of my university. I think that almost in every university, you can find some student scientific organizations. The name in our university, it's Student Scientific Society, triple S. So after 1 year in the Student Scientific Society, I became a head of this organization, because I was very active in the beginning, and during the whole period of my time of my when I was a head of this organization. I was 2.5 years in Student Scientific Society. I had been working as a head of this organization for 1.5 years on this organization. So during that period of time, it was a pleasure. I always I'm thankful for my tutors, to the students who who worked with me, and it was a great pleasure just to grow and to improve my hard skills and my soft skills. Okay, second course. Third course, after finishing the job in the Student Scientific Society, I got the invitation from my colleague, who was also the dentist in that organization. He was a president, and I've got the invitation to be a part of Kazakhstan Medical Students Association. Until now, this organization is the part of IFMSA, Federation, International Federation of Medical Students Associations. It's the analog of the IDS, International Association of Dental Students. Yeah, we will talk about IDS a little bit later. So I got the invitation. I started working, and we had been working during the pandemic. It was yeah, it was 2020. The pandemic started, and we just worked online, and we participated on IFMSA congresses online too. And it was a great pleasure, and it was an honor just to work with amazing people and to meet online. Unfortunately, online, but in that period of time, of course, we didn't have any options during the pandemic. And I realized that, yeah, good, amazing. So we have the opportunity to connect with the students worldwide and to meet new people, to have some connections, to go on the internships in the universities worldwide, abroad. So my friend and I, we started thinking about creating our own association. And we, after finishing the job in Kazimsey, we started about thinking of our own association because in that period of time, we never had before the association, student association for dentists in the Kazakhstan, whole Kazakhstan. So we named it. The name was in the beginning Kazakhstan Association of Dental Students, KATS, but later we renamed it to KD because we wanted to just also involve not only the students but also the postgraduates, for example, masters, who's doing the master's degree or PhD, etc. So we just a little bit renamed the last word, the student word to the youth, like Kazakhstan Association of Dental Youth. And it was 2021. And in 2021, we've sent the application as an association. We sent the application to IDS. IDS, we found information, of course, from Google. We found that this association working from 1951, founded in Denmark, and this association living so many years, step by step, from generation to generation, from how many years? More than 70 years, almost 70 years in that moment. And we've sent the application. I remember that our first annual Congress of Ideas, it was online because of the pandemic. The same also like in 2020. And in 2022, we just in 2021 also I participated later after I think the mid-year meeting, when we sent the application in the beginning of 2021. It was online, but in September, um, annual Congress in September of ideas, it was offline. And I created the group of the students, me, also two girls from our university, and also one student, postgraduate. We created a team and we went on annual congress. It was in Istanbul in 2021 on of ideas, like annual congress of ideas. So in Istanbul, and they've accepted application of joining KD, Kazakhstan Association of Dental Youth, as a member, full member of IDS. We've paid the all the bills from IDS, and we immediately after joining IDS, we've sent the applications to be like organizers of annual congress of IDS next year. So in 2022, I remember that our competitors, it was us, Kazakhstan, Turkey, and also Sudan. But Turkey, because of the organizational things, and in 2021 annual congress already organized, had been organizing in Istanbul. I think people they mostly they voted most of the votes they've sent for Kazakhstan. So we won this competition and we started preparation to this huge event. It was until now I think it's the most huge event that I've ever organized in my life. So it's a great experience, and that's what I'm talking about soft skills, hard skills, management skills, everything related to the people, to the network, because you meet people, you work with the people in the group, etc. So I will show also the presentation of annual Congress when we were preparing to the Congress. Also, in Kazakhstan, I've sent my applications for vice presidency to the vice president of for science and research position, and I won it. Yeah, happily I won it in Kazakhstan when we had the organization of annual Congress in Almaty in my city. And I had been working as a vice president for science and research for half year in IDS, and I will talk about it later. Why half year and not 1 year? And I had also the pleasure to work with Salar, yeah, because Salar was my right hand, and we just worked very intensively during this period of time in 2022, 2023. So it's also I forgot to mention that after Istanbul, before our annual Congress in Almaty in 2022, I've also participated on mid-year meeting in 2022. It was in February, and I visited Jordan. Jordan, Amman, yeah, the Amman, Aqaba, Wadiram, like these places where the mid-year meeting Congress was organized. And also we've sent the reports about the preparation to the Congress, our Congress in Kazakhstan. We organized the Congress. I won the vice presidency position. We started working. We had lots of work during the half year before mid-year meeting in northern Cyprus. The next after Almaty, the next Congress was being planned in Cyprus, in northern Cyprus, on the Turkish part. And our company, my company, Japan, we decided also to sponsor, to to just provide dental typodonts models for approximately 3,000 euros or something like that, 3,000 euros. So we provided the models. I've been there in northern Cyprus. We organized everything. And after that, it was like, the point where, like Rubicon, where you realize that you cannot work the same, like in the same position anymore. So I decided to work in different direction, not in the organizational things, but working more on the personal brand and working more as a lecturer, I think probably, yeah. So I will tell about it more after the discussion of why science is very important, and why uh, activity in the university community life is very important. So what do you think? Why it matters? Of course, it builds leadership and responsibility. Of course, when you work with a group of people, and when you're starting, like you are the leader of this group of people, of course you take the responsibility for the all the actions that you choose to do, and you of in that period of time, you immediately starting uh, improving your leadership skills, and you becoming more initiative. And what else? you expand your network and community. Of course, it's obvious. Opens doors, it opens doors to career and academic opportunities. We will talk about it later on the next slides when I will tell more about the scientific, the role of science in my life, and also that I recommend to do. And of course, when you have a great network of people, you great connections, and you are the leader, you work and get results, you work for the goals, you achieve that goals, and yeah, of course, you becoming more popular, and the people knows about you, people know about you. And you can improve your career as I did after the university immediately with Ivocla. So I think it's very, very helpful. It sharpens essential soft skills, as we mentioned, and boosts your confidence and visibility. So you're becoming more initiative as a leader. You are like you becoming an expert in communication, you becoming an expert in like organizational skills. Yeah, you can organize anything. After annual congress, I think that of course I don't want just to do it again, but in the future, for example, if I have the opportunity to do something for FDI or to do something for the great another associations like which helps me to work more confidently, like International Association of Dental Research or something like that. Of course, I would do it again. And the public speaking, the same also, most of the people in my environment in Kazakhstan, they ask me how I learned English and how I started making presentations and public speaking in English. Of course, in Kazakh language, in our own language, in Russian, like second international language after English, of course, it's obvious. Yeah, we speak in these languages more fluently, but in English language is becoming popular right now, I think, in Kazakhstan, and most of the kids and students, they learn more English and also Chinese language, I think, I guess. So my work in the association, in the associations, it helped me just to improve my English and to improve my public speaking skills. Documentation. Of course, when you work with anything in the business or in the associations, in the university, when you study in the university, of course, you need to do the documentation very well. So it will also help you. It helps you. Teamwork, yeah, we talked about it, and flexibility and resilience. And also we talked about it. So let's talk a little bit about the science, why academic research skills matter for dental students. Yeah. Uh, of course, when you analyze papers, when you do something with your hands, as I did, for example, on the first course, doing simultaneously with Student Scientific Society, I've got 3 scientific projects on the first course. First project was on the chemistry related to the dentistry. Second project was related to the anatomy, and the third project was related to the microbiology. So on the second course, of course, the projects I didn't take so many projects, so I had 2 projects on the second course, and until the end of my university life, I've got approximately 30 like 30 publications. It's like in CIS countries, it's like Russian index of the research publishing. It's not Scopus or Web of Science, but I'm planning to publish something this year or next year. So I've already applied to for publishing on International Journal of Dentistry in ideas, which will be in Shanghai this year in September. I'm participating there, so my abstract will also will be published there. So I was saying that critical thinking is very important. You analyze everything. You work with the numbers. You work with on Excel sheets, yeah, and you do analyzing work a lot. And of course, right now, when I was doing it more than 5 years ago, and we never had like ChatGPT, artificial intelligence for analyzing it. But with artificial intelligence right now, it's becoming easier to analyze a huge amount of the data, of the scientific data. So of course, it's now easier. So you have all the possibilities to do with less energy. You can do it. You can do more work. So it builds evidence-based practice. You can you can practice more with you can practice in a clinical way with the evidence-based data. For example, methodology in the prosthetic dentistry on the fixation, on the fixing the ceramics, fixing the onlays, inlays, etc. So you can do it using the evidence-based knowledge. It opens academic and international doors, and I really hope that uh, this will work also for you guys, because I'm doing my best just to do something in that direction, and that's why I'm trying to participate on the international congresses like Shanghai, or previous, as I mentioned, on the IEDS congresses, etc. So it boosts your credibility, and it improves teaching and public speaking, as always. And which skills you can develop during the academic research projects. It's problem formulation, it's scientific writing, reading and analyzing literature, basic statistics, research ethics, originality, of course, and presentation skills. Problem formulation, this subjects which I mentioned, yeah, we have approximately 6 subjects there, the main like thesis, and it's like the same for the business. I will tell you about the I will tell you more and show our company Japan. And when we found the problem that we didn't had enough models in Kazakhstan in that period of time, we've decided, my father and we decided to do something in that direction. We found the problem, we created the hypothesis. Yeah, we created the aim and like methodology, and we decided to do the production of this models using additive technologies here in Almaty. So the same for the science. So you can work more with English, you can work more with PubMed, ResearchGate, Google Scholar, and of course you will know more about the Excel, about the different calculators. You can do anything what you want to do in the scientific way, of course, with your tutors, with your teachers in the university. And I think that's the most important part of the scientific job, is just to find the right tutor, like the right teacher, who will teach you how to do correctly, and who will provide you his own or her own experience in that field. So I think that I've explained very deep, like correctly. So of course, it's the obvious things that we need to do something in science, we need to do something on personal brand or marketing, etc. We need to do something with our hands clinically. But I think the main problem in dentistry is like you can lose your target, you can use your goal during the studying or during the work, even after finishing the studying, and when you start your practice, when you start your work in the dental office, you will realize after 1 year or 2 years of the intensive practice, and of course, in the beginning, financial feedback would not be like high, but after you will realize that you get more money for the same things that you do, but you do it correctly with evidence-based knowledge, with the dental photos, and you will realize that you can just burn out. The burnout in dentistry is very huge problem right now. Even me, I have problems with burnout very often because I have different projects. I have courses right now. I have trips. I have work trips, yeah, and also I need to work with lots of patients as a dental associate. It's not my dental office, so it's a little bit hard, but I think after the changing the focus to your hobbies or to the sport, of course, you can do something with that, and it helps me. So what about the personal brand? We have approximately 15-20 minutes. So I think I will finish my presentation in 20 minutes, and we will have a space for we will have a time for the questions. So when you start your personal brand, and when you work correctly with the social media that you have in your on your phones, on your smartphones, you will stand out in a crowded field, because as you can see, dentistry is like prestigious profession right now, and most of the parents they want just to the children that they want to send them to the dentistry faculty, to the dental school, and just to have one dentist in the family, or a couple of dentists. And of course, it's prestigious. Yeah, I'm sure I agree with that. But in Kazakhstan, for example, it's in Almaty. Almaty is the population of the city, more than almost 3 million people. It's like number one number of population in Kazakhstan, the most populated city, Almaty. And we have for almost 3 millions of people, we have approximately 1,200 clinics. And in the one house, you can find 4 or 5 clinics. It's normal. For example, our clinic, it's like the premium clinic where I work, but it's located near to the mountains, closer to the mountains. It's more expensive, like part of the city. But next to us, there are 4 or 5 clinics next to us. Just patients can come to us, and after that they come to the other clinics. But the main thing I want to say that we have the competence in dentistry is very high. We have lots of specialists in dentistry. So you need to choose your specialty, and you need to be, from my point of view, of course, maybe someone would not agree, but in my point of view, that you need to choose your specialty and to be the best in your specialty. And of course, the financial feedback will be higher and higher year by year, because your professionalism and your skills will be growing always. So you will showcase your skills and growth on social media, you will attract patients, you will attract collaborators, partners, employees. It was also the same for ABC Clinic. ABC Clinic, it's like a premium clinic, and they invited me. They paid for my internship when I was in Russia for 1 month, and they invited me there. And of course, as a dental associate right now, I'm happy. But of course, in the future, I will be planning for academic, maybe to do something abroad. So right now the situation is very good, but I will do my best to grow my personal brand for having my group of patients in the to be just to have in the future more patients. Yeah, um, like just to have lots of patients in 1 month or 1 year. In advance. So yeah. So of course, for the personal brand, it's very important to take pictures correctly, to take pictures with softbox, with the dual flash systems. You need to use rubber dam. You need to isolate teeth. This case I've made last year in the summer last year, and we did a very great job. I will show the before photos of this patient later. So without photos, without high quality photos, you cannot be so your personal brand cannot be so well. So you need to buy good camera, you need to buy excellent lights, and for having great shots. For example, right now I use Fujifilm for anterior photos and Canon camera for posterior teeth. And the whole setup, if I count the price of a whole setup, it's approximately maybe 5,000 US dollars. So it's very expensive. And unfortunately, in Kazakhstan, it's very hard just for the general specialists, just for even for the young specialists after the university, just to save money for buying expensive stuff. But of course, after buying these expensive stuff, you becoming more like excellent doctor, and more patients will come to you. For example, this clinical situation, the young lady, 18 years old, came to the clinic with complaints about the lateral incisors, as you can see. But the main problem of these lateral incisors, well, it was that lateral incisors they didn't appear. So on the left side of the photo, it's as I remember, yeah, on the left side, as you can see after my preparation, it was the canine. On the right side, on the photo, it was milk tooth. So we needed to decide and to choose correct shape for symmetrical restoration. So we do isolation, we do preparation, we do anything, and of course, in the end, we have the result something like this. And of course, patient was happy that without veneers or without aggressive preparation, we can have a static result with a small, as you can see on the right lateral incisor, we have white spots under the enamel. It's everything. Everything was made by me, by my hands, with composites, with the photos, step by step. So it's before, it's after. So without clinical practice, unfortunately, you cannot achieve good results in your dental career. Of course, we have some exceptions like Anton Lebedenko, as I mentioned to you. in the beginning of I showed you the photo of a Russian guy, this tall Russian guy. He was invited from Moscow 20 years ago, more than 20 years ago, to Switzerland just to work in Liechtenstein in the Ivoclar. So it's like the exception, and he treats only the workers of Ivoclar company inside the company. He is not allowed, as I'm not mistaken, to work outside of his company in Liechtenstein or Switzerland. I don't know. So it's like sometimes we have exceptions, but you need to have a good portfolio with a great photos and with a great results, and you can work anywhere where you want, so like in any dental office, any premium or medium dental office, you can work there. So I will show you like how I usually do the digital smile design. Yeah, we do it in both way, with ceramics and with a resin. I showed you this case with a rubber dam isolation before. And we do, of course, digital smile planning after orthodontics. Orthodontists sent me this patient to do minimal invasive resin restorations. It's after bleaching, home bleaching, and after removing all the Invisalign attachments. And it's after, so as you can see, and also with rubber dam, also it was the final result of restoration. So before the 8 point, before it was the picture above. So you can see the difference. So without any photos, without evidence-based photos, you cannot show to your chef, to the guy who's building who's building this company where you work, for example, in dental office, to the head of the dental office. Uh, you cannot show the result without picture. So you need to take pictures, and you need to analyze your work, to work with trying to work with magnification, with dental loops. But of course, if you have microscopes, it would be amazing in your practice. So we've mentioned about Japan company. Japan, we founded this company in the beginning in January. I remember 2nd of January 2021. So it's almost 5 years. Right now it's 4 years and 7 months or something like that. And we are working and we are producing we produce dental typodonts, anatomical models, head and neck, for the head and neck region, for maxillofacial surgeons, and also for every direction in dentistry, orthodontists, restorative dentistry, surgical models, etc. So of course, I also organize the courses, so it very helps me on my courses just to make models which I want to do with my concept, with my my own experience, and to make it like personal, yeah, personal 3D models for the restoration, etc. So you can find me. We are finalizing my presentation, and in the end of this presentation, I want to say that again, I will tell you again which points you need to focus on. On this slide, you can find the QR code of Instagram page. It's my page on Instagram. You can find me. I've written there my email, Instagram, LinkedIn, everywhere. My nickname is Zhimamash, Dr. Jamash. So you can find me on Telegram. You can text me on Telegram if you want to ask something, or on Instagram or LinkedIn. So I would be happy just to answer if I have some free time. I always check my direct messages, so I always try to answer. So what points we need to repeat in the end of this presentation? So first point, that science, anyway, if you will have in the future your own dental practice, you need to work with the evidence-based protocols for the treatments of in every single direction in dentistry. For example, endodontics. Without evidence-based data, we cannot learn about endodontics, about prosthodontics, everything in dentistry, because it's the medicine, it's a medical field. So science is very important. So if you want just to improve yourself, additionally, science would be the best option. But if you have time to work to apply for some PhD programs or master's programs in the future abroad or locally, of course you can do it, and you can achieve more high results, and you can get the license if you want to study abroad. You can get the license there, and you can work in the future in that country where you're going. Second point is organizational things, management, soft skills, hard skills, everything related to the events. It's also very important. Some of the people, they don't want to organize anything, but if you want to improve your leadership skills, if you want to be the head of a group of people, if you want to be the head of a huge company in the future, I think it's a great like internship, like, better version of a CEO in the university. If you lead your association or if you lead the organization, it's amazing. It's amazing experience. So organization of the events, of the congresses, it's a great huge experience to that can be helpful in the future. So third thing is uh, third thing is the clinical practice. After the university or during the university, you need to practice more, and you need to improve yourself in that field that you want to do. For example, for me, I'm more curious, and I love more aesthetics. I can work hours of doing stratification technique or layering technique of the composites, or I can do preparation for veneers for hours. So it's up to you. For example, Salar, he's passionate on surgery. He loves surgery, and I'm happy that uh, that Salar is he sees the future in the surgery and all on the fields related to the surgery. Also me, why I did my residency on prosthodontics, because I love aesthetics. I want to do some complex rehabilitations after surgery. So surgeons do their job. We as a prosthodontists, we do our job we need to do it very well, just to save implants or any clinical situations with our crowns, veneers, or bridges, yeah, for years in the future for the patients. So clinical practice is very important, but from my point of view, you need to practice almost, um, you can practice for a couple of years, and you can just see and check your um, internal like feelings. Yeah, if you are happy with this situation, that you're working in the dental office as an associate, or you own your dental practice, if you feel happiness, of course it's amazing, you can continue and you can improve yourself. Or some people, they don't like organizational things, they don't like to be to think about anything like how we need to buy some materials, how we need to sell it, how we need to yeah, involve the patients, new patients. It's very hard to be the CEO of a dental office. So some people, they just only want to be dental associate, or they only want to be the part of university and just to work, to teach, to study, and that's it. So it's we choose our own way, but my way, I never thought that I would have the honor just to be in the beginning with Ivocla. Right now, I'm with GC. This year, I'm planning to go to Shanghai on the World Dental Congress, which will be on from the 9th of September until the 12th of September in Shanghai, in China. And then in Belgium, also GC company where I work right now as an opinion leader, they are inviting me to the Belgium. So we will see the situation, and we will plan, of course, a little bit later. I think in August. So it's great. It's amazing. I love people. I love teaching. So I choose my own way. I'm stopping right now with PhD. I will plan it to do in the next year. So this period of time from now until the next summer, I will just do my clinical job, and I'm going to do just as opinion leader, I'm going to do courses and participate on some clinical practical courses, and just to um, provide it to my students on my courses. So yeah. So that's it. I think that's everything is clear. I hope that you understand everything. And if you have questions, of course, I would be happy to answer.
Thank you so much. That was amazing, Dr. Jamash. It's clear we're hearing from someone truly accomplished and inspiring, and it was perfect. And if anyone has a question, they can raise your hand or write in the text chat box. And I will ask some questions from you about the student life and direction. Many students struggle with the feeling of being lost or unsure, during the dental school. What helped you shape a more purpose-driven or motivated student life? Can you share with us, please?
So the question about the fear, right? In
Yeah.
during the yeah, okay. So of course, we have different temperaments, we have different characters. Each person is individual. But in my situation, I've got, I will just tell you a little brief story before the university. When I was finishing the school, and when I was applying and finishing, we have uh, like governmental test for having the number of a test, the final result of this test. It would be it depends on the test how you can achieve your application to the university. For example, if you achieve 140 degrees, yeah, like bows, everything correctly, you achieve the test, you can apply for the grant, and you can study on the grant in the university. But in the situation with in the end of the school, high school, I finished my test. Of course, the grade was approximately 130 from 140, and the financial situation in that period of time was not so good, and I didn't know that my father can let me go on the like not grant for payable education, yeah, for the School of Dentistry in that university where I studied. But I think God heard my praise, and I never wanted to study general dentistry or general medicine, because you need to study for, I don't know, 15 years or 13 years if you want to be like surgeons, etc. So I didn't want to spend so much time, and I was praying um, that I want to be like in dentistry. So I've sent the application to the university, and the Ministry of Education of Kazakhstan, they've provided the list of the grant spots. Yeah, who won the grant on the dentistry or who won on the general medicine, etc. So for the first time, when they shared this list of the winners of the grants by Ministry of Health and by Ministry of Education, in the first list, I was in general medicine. So I don't know, probably I would be, if I if I go in that moment of time, if I go to the general medicine with a grant, I would be probably maxillofacial surgeon or something like that through the general medicine, uh, because uh, uh, because any directions like cardiac surgeons or different any surgeons except the maxillofacial surgery. It's very hard, and the risks are very high, of course. But I thought that if I don't have the financial opportunity to, I would study, but I would be a maxillofacial surgeon in the end. But by the luck, I was very lucky in that year, and the Ministry of Education, because the parents in the capital of Kazakhstan, in Astana, they had the conflict, very huge conflict in the capital. So they sent the second list of the winners, like they did a competition again, and they showed the second list of the winners of the grants. And on the second list, I was in the deep depression. And one my friend, they called me, and he called me and asked that I'm in the dentistry. So I was shocked. So when I was checking the list of the second list, I I didn't know about the second list. So that friend showed me that they sent me the list, and then when I was checking, I was in dentistry. So from that moment, I realized that if I didn't have the luck, if I didn't have this possibility from God, I would be like spending many years in general medicine or in different profession probably. So after that moment, I gave a word just to God that I will use my precious time, my like this precious moments of my student life. Uh, I would be spending for serving people, for serving organizations, and also to do something helpful, useful for the students, for the people surrounds me. And step by step, uh, somehow I joined Student Scientific Society, and after that, as I told you in the presentation. So I think the main thing with a fear, you need to find you cannot find your purpose, but you need to create this purpose from like the meaning of your life. If if you think that okay, I will finish the university and I will earn money, and I will earn so much money that I will buy a house, I will buy a car. Of course, it's somehow it helps us, it motivates us. But I think the deep motivation and deep discipline in the whole career in dentistry, as I said, burnouts, the stress, the conflicts, you need just to have the purpose inside your heart, just like mission. for example, I want, my dream is to open in the end of a life or in the 50s to open university. Yeah, open like educational, huge educational center because my passion is to teach dentists. So I want to spend my life and I will not regret in the end of his life serving people, serving dentists, students, and opening my private, for example, our private like university. So I want to do my best to use this. We are young, we have energy, so we need to use this energy in correct way. So how you can manage the fear, you need to create the mission in your heart, and after creating you need to just imagine the end points. For example, just imagine you are 50 years old in the future, and who you want to be in the 50 years old. I want to be like, of course, the financial part is very important. It's good that you want to be a millionaire or billionaire, but we have so many ways to make the wealth. Yeah, and we can teach people, we can provide some service, you can open dental offices. Each mission is individual as each person. So I think that's in my life it works like that. I created the mission and this passion, this roadmap to the opening the university in the future. So I want to do something. I want to be lecturer. Later, I would do my PhD to have the academic status, and after that, we would do something. I don't know. So yeah, that's it. I think somehow the your life is in your hands. So that's it. You, of course, God helps
Thank
you, but God helps to them who works very hard, not laying on the couch and like on the sofa and waiting for something. Yeah.
Thank you so much. Okay, Salar, you had a question? Go ahead.
Yeah, you have my voice?
Yeah,
Yeah.
yeah.
Okay. First of all, I have to express my gratitude to dear Dr. Jengish, dear Fatima, to have this perfect session. I want to actually conclude the first part of my talk, and in the second part, I have a question. As I learned from your speech, student life is not only studying and passing the courses, but also it's challenging, it's facing new challenges, is trying to actually move further than university and try new ways, try new challenges, try new international challenges. So like as you remember, IADS we worked like KD you did but there is a question that, okay, imagine that I am a student and I want to participate in these, for example, associations and programs, but I don't know how to recognize the programs. Where are the programs? How can I actually know, okay, there is an association named IADS, or there is an association named, or I have the opportunity to actually being a key opinion leader of GC. For example, maybe many students don't know that, okay, there is a way that you can actually be, for example, A person, B person. How can students find out the ways that they can participate and they can grow up?
So the question about how to find the way, correct way, right? Just to
Ways to associations, yeah. And how, for example, how they can know, okay, there is an association named IADS, or there is an association named IFMSA.
okay. Um, so how the students can be the part and how they can be involved in that activities, I think if you have no possibility to go through the local association from your country, of course, if you don't have, for example, association, you need to create it, or you need to ask. Of course, we have the open world, and we always, for example, I'm a very curious person, and I think the best advice is just to not to fear, just don't be afraid of writing an email and send it an email, and just to ask what should we do. For example, I'm a student, and I'm a third year or fourth year student. I have this skills. I'm attaching this my CV. I have this portfolio. So what should we do, etc. So I think the also professionals, open-minded people from the associations, they can give advice. But how to find, for example, some programs, how to attend on the courses, that events where I attended on the ideas, it was not funded by the university. So I was trying to find, so with the Jakan, I earned the money from that project with the typodons, and I used that money. I reinvested the money to the equipment, of course, and the left money that I had, not so much, of course, but I used it for Istanbul, for Jordan, where I went to Jordan, and I just found this way using the money without funding, without our university didn't fund in that period of time to different congresses. So I tried this way, and it worked very well. So of course, if you are surgeon or you're planning to apply to some international internships in the future, also ITI, Salar, do you know about ITI group
Yeah,
of
I know.
that? So, you know, I have one friend from Switzerland, he's Russian. His name is Andrei Latishev. Andrei Latishev, I will send you the link. So
Thank you.
I also had the online, I uploaded this video. It's in Russian language, but I uploaded the video on YouTube, and we just had the conversation how he joined. Just imagine, he's 30 years old. He studied maxillofacial surgery in Moscow. After a couple of years of working, he opened the clinic with also with additional two founders, so three founders opened the clinic. Blanche, the name is Blanche. From French language, its translation is white. It's like, you know, he just created the name, this name Blanche, for the clinic, where he found the bus stop in Geneva in Switzerland, where he attended on the course on the internship on ITI internship, and the name was Blanche, so he created this name. But he said that he was invited uh, by the head of the Department of Reconstructive Dentistry of Geneva University after that Andre attended a couple of times for free. ITI covered all the expenses, and he attended for free, and he got the invitation from the head of the department to make a doctorate degree. They have in Switzerland, they have doctorate degree, and they had the license immediately. So he was working. Had been working for, I think, 2 years as assistant of the Department of Reconstructive Dentistry in Geneva, and he just finally, I saw on Instagram recently that he has got this doctorate degree in Geneva, and he has all the possibilities to work there. But he works in Moscow and Geneva. So
Yeah.
the main thing is just you know, just to search with artificial intelligence or with Google, to search possible grant programs. But in my way, it didn't work. I just yeah, it worked from Ivoclar. Ivoclar covered the expenses, but because of a personal brand, they knew that I'm a organizer, or I was the president of Katie, and they were interested, so that's why they invited me. So first of all, of course, you just need not to spend time for only for studying. You can improve your personal brand as an organizer, or
Yeah.
just sign or etc. And simultaneously, of course, the companies can invite you to cover all the expenses. So, for example, implant companies also,
Yeah.
they cover
Yeah.
expenses courses in Switzerland, or just in Korea, and in
Yeah. Korea.
Korea, yeah. So in the students associations, it's a little bit harder because it's up to the university where this student will study, and it's up to the invitation part who invites. Probably they also can cover some of the
Yeah.
expenses. Just
Thank you.
just we need to search more because we
Thank
have
you.
everything for that.
My last question, may I, Fatima?
Yeah, yeah. Go ahead.
Okay. My last question is that, okay, most of the time, many students might be afraid or might be feared about being rejected. For example, uh, most of time they talk to me and they say, okay, we want to apply for that program, but we're afraid of being rejected. And I want you to talk, for example, as we don't have much time, talk briefly about the point that, okay, it's okay to being rejected. It's okay to actually, we ask for some positions, we ask for some projects, we ask for something and being rejected, and this is not the end. We can start again. We can start to try another ways and something like this. Thank you.
Yeah, okay, I got it. So being rejected is, of course, it's not the end of the world, but for example, from my experience, I got so many rejections. Of course, being rejected, it's of course it's hard. Every time when I have some problems, of course, I just react very close to the heart. Just it's very hard for me too. But I realized that I had one skill, just to improve, just to use this negative energy, in the correct way, and just to use it effectively. For example, for almost maybe for the last 2 or 2.5 years, we were trying with one IT specialist, and with me and the IT specialist, we wanted to won some startup funding, like $5,000 or $10,000 on the IT startup competitions, as you know, yeah, on the IT battles, etc. So we were rejected everywhere. In my university, this year it was very interesting. They also organized the IT battle with artificial intelligence projects, and we just I was very curious, and we used our project Japan for producing the dental typodons. We just wanted to create the app with artificial intelligence for creating the personal, like roadmap. You just want to improve. For example, you talk with artificial intelligence, you text there that you want to improve this skill, this skill, this skill, clinical skills, I mean, and the artificial intelligence provide you the methodologies, all the information, and also how to use correctly this typodons to prepare clearly, etc. Even its work, I think, navigation. It's like, navigation in implantation, but it's more like and it's navigation with artificial intelligence in restorative dentistry and prosthodontics, not only in implantology. But when we were reporting to the investors and to the guys, they are maybe 40 years old, 50 years old, they told me, what the fuck you are doing there? Because you are already making money. You have like family business. We don't want to invest in your business. So, every time when we wanted with IT specialists to attend on some battles and to do something, we've got rejections. We were being rejected. But I can understand that for the students, it's very hard. It's the first step in like showing yourself as a like as a scientist or as an active member or as a member with a great project, etc. Just I think the good advice is just to do it as much as you can until you just lose this, you know, this fear, and you will never think about the end, that you will end this project. So I just from my experience, I do it a lot. We get lots of rejections, but I don't think that maybe the project is the bullshit. Of course, we test some theories, we analyze the reactions of the auditory, etc. But we of course, it's evidence-based, if people says that you are, for example, you have a bullshit project, it's not evidence-based information. So you need to think like in scientific way. And that's it. If you do it in Excel, for example, Excel with the numbers, and you analyze, and you can think that, yeah, probably we have a problems with this, we need to change it and do it in another way, but not thinking that you have a bullshit project, etc. So just making it
Thank
as much
you.
as you can, yeah, and just for losing
Thank
this
you.
fear.
Thank you so much. I think you said that the students just should trust the process and not focus on the outcomes. It is better to say that way.
Yeah, of course, because dentistry, even me, for example, in the clinic, it's a very interesting situation. Trusting the process, yeah. Um, for the clinic, for example, if you want to have aesthetic rehabilitations, 20 veneers, etc., it's not like for one moment. You will not do it for just in 1 second, and you need to work maybe 5 years. I'm working 4 years, and I didn't do yet the full mouth rehabilitations, so like 20 veneers, 28 veneers, onlays, inlays, etc. So in my clinic, I have my colleagues. Of course, I respect everyone, but sometimes you can also be, maybe Salar also, you've met the people like them, people who are older. They think that you are like young person without any skills, and they ask the head of the department, asking, hello, this Dr. Jeng is doing very good job or not, just yesterday or the day before yesterday, I got the call from my tutor, from my, like he's the tutor from Krasnodar, from Russia, this inside of ABC clinic, and he says he laughs, he was laughing and saying that gnathologist who working with TMG, joint problems, he was asking that does Cengiz doing good job with the restorations or not? Because it seems that he's doing restorations for health on the health teeth. So he said it's a bullshit. So of course, you need to respect everyone, but sometimes some jealous people would show, and just to do something against you, or just to ask to ask something when you don't see, when you don't hear, etc. But only, I think, the trusting the process is the only way just to achieve good results. And I think that if I work in the same rhythm, with the same speed, in this direction, only one direction, aesthetic rehabilitations, of course, I will have the cases, and I will be like fluent in the closing the problems and solving the problems of the patients. So yeah, unfortunately, we are not IT specialists to do it like in just 1 second, and just to open as you know, with Facebook company, Amazon, etc. Of course, even in that companies, it took some time just to be very successful. So the same in our job, also the same.
And I think we have about 10 minutes. And I have another quick question from you about the clinical experience you talked about. I wanted to know that how did you figure out what you're interested in? Because you were very passionate about the aesthetic dentistry. And I wanted to know that how long did you work to find the way you are interested in so much?
Okay, thank you very much. Very interesting question. So as I said, from the third, fourth year, I was started working on the patients. Of course, we do some simulation treatments, but on the patients, it's a very good way just to try something on the patient's mouth. And I just tried surgery, also extractions. I tried to do something with perio, and also orthodontists, everything. And I just talk so much with the people who is in each direction for 10 or 15, 20 years, and seeing the pros and cons of each direction. And I realized that during the process, during the restoration, and in that moment, when I was a fourth year student, we had Olympics, dental Olympics, on the restorations of resin restorations, direct and indirect restorations. So I loved the process. In the process, when you see that you cannot check the time, and you can work for hours with one process, of course, you can just be confident that you already found your passion. So for example, in our clinic, we have endodontist who works endodontics so much, and without root canals, she cannot imagine her life. So the same with restorations. I hate endodontics. Unfortunately, I really hate endodontics. But but restorations, doing these layering techniques, contact, second-class restorations, or preparation on onlays, veneers, it's great. So how to find the correct way. Also, the one moment I wanted to tell, it's from ideas. When I was in Cyprus, northern Cyprus, when I resigned the position for the vice president for search for science and research, I just in that moment, also from my friend from Kazakhstan, he was the vice president for finance, and he asked me, do you want to stay? I can resign and I will leave, and you can stay there in ideas. And in the moment, sitting in the chair in the presidium during the ideas session of General Assembly, I just realized that it's not so, I cannot get so much good results, and I don't have passion in that. We know different people from ideas working there for many, many years and loving their jobs. So yeah, I'm happy for them. But for me, I realized that I'm more happy when I work something on the patients, and when I show the results on the courses. So I just resigned, and I just understood that a half year as a VPSR, it was enough for me, and sleepless nights and these all calls. It's not giving so much feedback, positive feedback in the future. So yeah, that's it.
And the other ways open up for you, which were better for you, of course.
Yeah. Just you just need to improve the skill to say no. Like I said no to ideas, and I just after that I never connected to ideas, and I just realized that yeah, it's enough. I did the congress. I attended on each congress so much time. I attended. We sponsored 3,000 euros for ideas for that Northern Cyprus from Japan, but it's just because I was the VPSR, and I wanted just to be like very clear, very confident that everything will be good with from the simulation part and the models. But I realized that it's not so good for me in the future, so I said no, and I said yes to the lecture stuff, and I improved in there. So yeah, just
Exactly. Thank you
now.
is a very important soft skill too. And as you said before about soft skills, as you are a very successful lecturer, do you offer any links or sources for the students and young dentists to know more about soft skills and improve themselves? Can you offer any links or YouTube channel that you have
Uh,
studied?
I can mention a couple of offers from YouTube. I read lots of books, but right now in the global world, as you can see, we have TikToks, etc., and the attention. We cannot check. We cannot without the distraction. We cannot see one video for hours. So that's the main problem right now. So just the main offers on YouTube that I can recommend, it's if you want uh, passion, like something about the passion, Daniel Dallin. Daniel Dallin is an entrepreneur from Hong Kong. He's from Netherlands, but he's doing his business in Hong Kong. He knows China, and this vlogs. Uh, re he rebuilt the vlog style of on the YouTube. Before Daniel Dallin, the vlogs were dead on YouTube. So you can check, and you will be happy with image quality and with a person, Daniel Dallin.
I
Um,
write correctly
uh,
in
yeah,
the
yeah,
chat.
Daniel Dallin. Also, the next one, I think rich role, if you want to be focused more on the health, because health is very important for us, and if you want to if you want to watch the podcasts with the amazing people coming to the rich role is he's the athlete. He's very inspirational person, and you can get this inspiration from ritual too. So Daniel Down ritual. Who else? Let me think. Yeah, just about the soft skills. About the soft skills, like you probably know about the Iman Gaji. Also, just let me. I think his name is correct. Iman Gaji. Also, he's very close to the Daniel Down, but Iman Gaji is more about like business, etc. Of course, sometimes they show a very luxurious life, but the main thing is just to you can learn how to improve the personal brand from Iman Gaji, because he's doing very great job with the personal brand.
Thank you
From
for sharing. these YouTubers, and I think we are going to lose the electricity here, as you may know. The situation is not very well here, and
Right.
I wanted to thank you, Dr. Jamash, Dr. Chaichi, and to all of you for joining us today. Wishing you success in your studies, work, and life ahead.
Much.
And before we say goodbye, I wanted to ask you to smile. And if it's okay to open your camera, we want to take a screenshot now. Okay. 1, 2, 3. Thank you so much. And I think that's it. Thank you, Dr. Jamash.
Thank
It
you,
was a
Al.
session,
Yeah.
and we really appreciate your time and all your efforts. Thank you.
Thank you.
Thank you, Cengiz. Thank you, Fatima, for this insightful session. Thank you very much. And yeah, goodbye.
Yeah, thank you.
Bye, guys. Keep in touch.
Yeah, sure.
Goodbye. Thank you.
Bye.